Let's talk about some of the symptoms of vitamin B12 deficiency. These are some of the top ones listed here on my slide that I see in my practice, right? So we see anemias, we see depression and neuropathy and dementia, people losing their ability to think clearly, brain fog and the like. We see a lot of joint pain and lethargy, and this is a fatigue and lethargy. Really, what I would say when vitamin B12 deficiency causes an anemia, which we'll talk more in depth about in just a moment, one of the biggest side effects is that fatigue and lethargy. But it's especially true even if you're sleeping well. So after 8 hours of sleep or more, you're still tired. You're waking up tired after having adequate sleep. Think anemia. That's your thought. Now, there are a number of different nutritional anemias. There's iron deficiency anemia, there's B12 and folate deficiency anemia, there's copper anemia, B6 anemia, vitamin C anemia, vitamin E anemia. But this is one of the most common ones. And so if you're feeling this way, think anemia and ask your doctor to check your B12, ask your doctor to check your what's called complete blood count, your iron and ferritin levels, and rule that out for you. We also see hair loss in folks, and this is especially true of women more so than men, a lot of hair loss with vitamin B12 deficiency, and glossitis. Now, glossitis is a swelling and redness or reddening of the tongue. So if your tongue is a super bright magenta color, when you stick it out, look at your tongue in the mirror. If it's super magenta in color, consider vitamin B12 deficiency and potentially other B vitamins as a possibility. Now, there's a lot of research. I've kind of hand-selected a few things to share with you today. This is a nice publication done here recently, put out by the British Medical Journal. And what they did is they looked at a lot of the data in the medical literature, and they tried to stratify the prevalence of the symptoms of vitamin B12 deficiency. So what you can see here in this diagram is 85% of patients with vitamin B12 deficiency had cognition problems, mental health problems, and neurological problems. So look at these three broad categories. That's 85% of people with deficiency reported memory issues, cognitive impairment, aphasia, learning problems, headaches, and migraines. They also reported mood swings, irritability, insomnia, depression, anxiety. Some reported hallucinations and delusions. We also see in the neurological aspect paresthesia, which is numbness and tingling, poor balance or loss of balance, tinnitus, ataxia, also loss of balance, myelopathy, spasticity, autonomic dysfunction. And then over here you can see 15% reported something called pancytopenia. Now, this is not so much of a symptom as it is a clinical manifestation. So what does that mean? Pancytopenia means that you frequently have low white blood cells, low red blood cells, and low platelets. So if your blood work's coming back low on all three consistently, and nobody's been able to tell you why, and you've been to the hematologist and there's no answer, think vitamin B12 deficiency. It's very common to see this pattern. I see it on a regular basis in my practice. You also see something called macrocytosis. We'll talk more about that, and hypersegmented neutrophils. So again, these are more medical findings. So your doctor, if they're finding these things, if your doctor's ever come back and said you have these things, ask him to measure your vitamin B12. Now, you can also see here the bone marrow, if you've got hyperplasia or megaloblastic features in your bone marrow. Again, this is a doctor. If you're being told this, B12 should be being ruled out. You should ask your doctor to rule out B12. So whereas these things are things you might feel on the top, these are things that your doctors might find through investigation. And if you're being told these things, think B12. And then over here, you can see glossitis, which we mentioned a minute ago. But then taste impairment, if your taste buds are off or you can't taste as well, you might consider vitamin B12 as a potential possibility. And then something called aphthostomatitis, which is cracks in the corners of your lips as a symptom. So if your lips right here in the corners on both sides are cracking aggressively, that's aphthostomatitis. Then we have other complaints of abdominal issues, poor appetite, weight loss, ladies, infertility if you're struggling to have children, and then hyperpigmentation of the skin. Now, I noticed down here, you see this little sign on these. This is prevalence variable, meaning these reports were not as consistent as these other symptoms. But again, that's a generalized breakdown of a lot of reports in the literature. Here's kind of part 2 to that. You can see, let's blow this up for you. Brain function. So brain fog, memory problems, cognitive impairment, insomnia, trouble going to sleep, falling asleep, staying asleep, headaches, especially migraine headaches. B12 is actually a migraine prophylactic. If you look at some of these over-the-counter nutritional supplement formulas, almost all of them contain vitamin B12. They also contain B2 and something called feverfew. A lot of them will contain magnesium as well. It's because these nutrients are migraine prophylactics. You'll also, with B12 deficiency, behavioral changes. So this more specifically with your children, if you're seeing like abrupt changes in your child's behavior or learning problems, you might consider vitamin B12. And this is especially true. A lot of kids, they've grown up in a world where, well, honestly, where real food is not always available, and a lot of the garbage that they're serving at the school, the protein, especially the protein sources, are garbage. And so these kids are being malnourished through the school lunch programs. I'm hoping that's something that will change relatively soon. But and so they develop these B vitamin deficiencies, particularly B12 in this case, and then they start getting in trouble at school, and they start having problems with learning. And then aphasia, or difficulty swallowing, can also be a problem, a symptom. And then we've got mood dysfunction here, so irritability, depression, anxiety, as I mentioned before, hallucinations, psychosis, peripheral paresthesia. So this is the pins and needles that you feel in the fingertips or the toes, the numbness, the neuropathic pains, poor balance. So then we get to reduced vibration sense or proprioception. Proprioception is you lose balance because your joints, the nerves inside of your joints that tell your brain about your position, start to malfunction. These things, and we also see deep tendon reflex changes. So just to show you, this is a 128 hertz fork. And what your doctor can do, this is a lot of doctors should have this in their medical bag, but if they hit that fork, it's going to vibrate or oscillate at 128 hertz. And so you may not be able to hear this, as I've hit it, but this fork is vibrating right now, and I can feel it in my fingertips. Now, when you vibrate this fork and put it on the toes of a patient, one of the most common symptoms of vitamin B12 deficiency is the second and third toes will not feel the vibration sensation from 128 hertz. This is a very early indicator that you might be vitamin B12 deficient, because B12 is necessary to preserve the myelin. And in those distal toes like that, we'll see that's where it's disrupted first. The sensation starts to go. So it's a real, and this is something your doctor can do if your doctor knows how to do a neurological exam. But a vibrating fork is something that every doctor should have in his medical bag as part of his physical exam ability. So that's vibration sensation. That's how we know vibration sense is lost, and that's how we can detect it in an early fashion. And then ringing of the ear, loss of balance, taste impairment, as I mentioned before. So under constitutional, we've got fatigue. And as I mentioned earlier, anemia plays a major role in that. There are a number of different types of anemia. We'll get more into that here in just a minute. And then low red blood cells, low white blood cells, low platelets. We also see motor symptoms in the muscles. We see muscle weakness. Muscle weakness, meaning you don't know why you're losing strength, but you're finding yourself weaker and weaker. We see this a lot in the elderly, where they lose their ability to get out of a chair. It's very hard. They have to push themselves up with their arms to help their legs because their leg muscles are becoming weaker. And also altered reflexes. Now, you've seen one of these maybe before. This is a reflex hammer. You can hit different tendons with it. Usually they hit the knee. If your doctor's ever done one of these where he hits your knee with a hammer, that's a reflex hammer. But what we see when vitamin B12 deficiency starts to develop is that your reflex, in other words, your leg doesn't kick quite as much or quite as aggressively, and sometimes not at all. So this is an altered reflex, a reduction in the reflex response. And so there you have reflexes all over your body. You have them in your knee, you have them in your bicep and in your tricep tendons. You have reflexes at your Achilles tendon, in your ankle. So these are all areas your doctor can do an exam and perform. And again, if you suspect B12 deficiency, and maybe your doctor won't measure your levels, maybe ask them to check your reflexes and ask them to get a tuning fork out and measure your vibration or your vibratory sensations, because these are just simple think of these as low-tech ways to detect that B12 deficiency. Beyond that, you can, again, down here, spasticity of muscles. So if you're chronically having muscle spasms, seizures, and then even cardiomyopathy. So the heart muscle, because remember your heart's a muscle, starts to deteriorate and break down. And then we have autonomic symptoms as well, and this could be incontinence, either urinary or fecal, as well as postural hypotension. So this is when you're standing from a seated position. A lot of times your blood pressure will drop, you'll get dizzy. This could be vitamin B12 deficiency. We see this a lot in POTS. And then erectile dysfunction. Guys, if you're struggling, consider vitamin B12 as a potential possibility. So lots of different symptoms here. I talked earlier a little bit about this, so I'm just going to bring it back up here. And that's B12 deficiency might be related to sarcopenia in older adults. You can see the highlights of this study. Sarcopenia, new geriatric syndrome, which related to worse health outcomes, morbidity, and mortality. Micronutrients such as vitamin B12 may play a role in the pathogenesis of this. Vitamin B12 deficiency is common in older adults and should be checked periodically. Key takeaway here, folks. Should be checked periodically. You got to demand more from your doctor. Nutrition has been ignored for far too long. It's time to take it back. It's time to demand that doctors get on board, because you're paying for your insurance. And so a lot of this is you're spending a lot of money for insurance. And the reason why you're paying that is because you want your doctor to be able to treat and diagnose your situation and have a conversation with you and have insurance cover that bill. But really, insurance is not covering that bill. Who's covering that bill? You are, because you're paying these big premiums into this program. And so what's actually happening now in today's medical system is doctors live in fear that if they run your B12, for example, then the insurance company is going to flag him or her as aggressive or a bad doctor because they're doing things outside of the typical standard of care. And so the doctor doesn't want that to happen, because then the insurance company quits sending that doctor patients. So basically, you're paying all this money for your insurance company to tell your doctor not to do tests on you and to cut the bill and to shave the bill and to be less diagnostic in the process. So demand, because the only way we're going to change that system is demand it. And call your insurance company and say, you need to add these things to coverage. Or demand that your insurance company cover the things that your doctor deems medically necessary. But don't let them get away with it. There's plenty of evidence, research-based, that corroborates what I'm saying here today.